The swell body of the nasal septum. The swell body. This is the swell body of the nasal septum. This is the inferior turbinate, middle turbinate, nasal septum, and in that is the swell body. The swell body of the nasal septum is a distinct structure located in the anterior part of the nasal septum, adjacent to the anterior part of the middle turbinate, and the superior part of the inferior turbinate. The swell body of the nasal septum. Structurally, it contains bone and cartilage components of the nasal septum and swell tissues involving bones and cartilage. Kohlner first reported the swell body in the nasal cavities of humans. Schriefferdecker called this structure on the nasal septum a tuberculum septi. Previous studies have suggested that the swell body of the nasal septum is a part of the nasal cavity and plays an essential role in regulating various physiologic functions. The nasal swell body has been a surgical target of interest, and hence surgical procedures have also been attempted to reduce its volume in recent years. The swell body of the nasal septum. These are pictures we have routinely seen but neglected or not realized. This is the inferior turbinate, septum, middle turbinate, the swell body on the nasal septum. Earlier we thought that the septum above was deflected. No, this is the swell body seen on zero rigid endoscopic view and depicted by this asterisk here. Nasal examination. Under typical conditions, the nasal septal swell body can be readily visualized using anterior rhinoscopy. If the patient has nasal disease such as inferior turbinate hypertrophy, it is necessary to use nasal decongestants before nasal examination. The expansile structure, so far we have ignored the swell body of the nasal septum. Nasal septal swell body may be misdiagnosed clinically as a high septal deviation, as pointed out in previous various literatures. This is the swell body of the nasal septum. Nasal septal swell body is covered by a thick pseudostratified ciliated epithelium with goblet cells. It is a highly glandular tissue, mainly consisting of seromucinous glands with moderate venous sinusoids. Elvani reported a conclusion slightly different from the study, in which he found glandular acini and dilated blood sinusoids. These rich glandular tissue seem well adapted to the drying effects caused by a high airstream impact. The existence of a certain number of blood sinusoids confirms that the nasal septal swell body is part of the expansile vascular tissue in the nasal cavity. Physiologic effects. Histopathological features suggest that the nasal swell body is a unique structure that can play a vital role in regulating nasal airflow and adjusting the temperature and humidity of the inhaled air stream. Nasal septal swell body changes the nasal airflow direction, splitting the inhaled airflow in two directions. Number one, towards the nasal meatus, and the other towards the osteomeatal complex, which increases the contact area of the nasal mucosa and thus better serves as a warming and humidifying structure. Common respiratory viruses can replicate rapidly in a cooler upper airway environment of 32 degrees, but the replication is restricted at a body temperature of 37 degrees. When infected with respiratory viruses, the human body can limit the replication of respiratory viruses by regulating the nasal cycle to increase the nasal mucous temperature to 37 degrees through nasal congestion and nasal obstruction. Nasal septal swell body is similar to the inferior turbinate and participates in the nasal cycle. Therefore, we speculate that the nasal septal swell body also has protective effect against respiratory viral infections. CT scan of the paranasal sinuses showing the nasal septal swell body in the septum, and this is depicted by the green crossed lines. That's the coronal section, axial section, and sagittal section, the nasal septal swell body. Patients who have already undergone septoplasty should wait at least 3 months before undergoing nasal septal swell body reduction. Performing surgery on both sides of the nasal septal swell body can also increase the risk of septal perforation. Future directions. Nasal septal swell body is a structure that remains to be recognized, and further investigations are needed to unveil its physiological effects. The nasal septal swell body is a 3D structure, not a bidimensional one. Previous studies measured the data of various planes and attempted to present its 3D feature. The nasal septal swell body includes a part of the bone and cartilage of the nasal septum rather than an expansile soft tissue alone. Present studies do not involve them. Thus, with 3D reconstruction, the nasal septal swell body can be measured precisely. And second, the swell body is a dynamic structure that may change its size and shape with the nasal cycle. However, this hypothesis needs to be confirmed by in vivo imaging assessments. A comprehensive overview of the nasal septal swell body.